This is part 2 in our sequence on the important questions that you must ask if you've been diagnosed with breast cancer. Now, the previous video, that was intended to help you establish a reference point so you could better understand your type of breast cancer and equip you to make informed decisions about your treatment and to help take the moment-to-moment panic out of it, because for the most part, the diagnosis of a malignant disease is not an acute medical emergency. So the time that you take to pause, reflect, and figure out all the parts, that's going to mean that you're going to have a much more balanced, long-term, strategic approach to your treatment decision and your treatment. For example, not every woman with a stage 2 breast cancer is the same. I mean, it might be very well that the actual treatment turns out to be the same, but the way you time it, where you give it, and the extent to which you push it, that's all part of the interaction between the patient and her oncologist, much the same way as the tumor and its progress within your body is a function of the interaction between the patient and the tumor. So I encourage you to trust that it just might be beneficial to further draw out what having this disease means to you and how you actually define yourself, because it's important to have all the issues on the table before you make your choices. And this includes issues that you might feel uncomfortable exploring at this point, yet you really want to know. I mean, that said, there are questions that I'm doubtful I can guide you to ask, because there's questions that are too painful to ask. I've witnessed many newly diagnosed women who want the answers, yet they are petrified to know them, and so they're afraid to ask the questions. And it's times like these that you'll be grateful for the guidance for picking out a doctor that's really well suited for you, because it's important that you pick one who really cares enough to mentally catalog all those types of questions that other women have asked over the years, and therefore is sensitive to those more private concerns. I mean, someone that may sense that you want to ask a particular question at any particular moment, and they sense that you're scared to hear the answers. And so that's when a real good doctor might, as they're talking to you, casually and softly drop little hints that, they're open to such questions. They're just, pushing the door open a little bit to see whether you're brave enough to come through. And that you shouldn't really be afraid of asking anything, that they're prepared to answer whatever it is that you need to discuss, whether or not it's related to death or you've got questions related to the cosmetic outcome of your surgical procedure. Many women are frightened to ask about how they'll look and what it'll feel like, whether they have a lumpectomy and radiation, or a mastectomy with reconstruction that's following, because they're thinking to themselves, here I am, I'm dealing with my life. This is life and death we're dealing here with. And I'm thinking about how I'm going to look and feel. Isn't my doctor going to think I'm vain or that I have all my priorities twisted? No, no. If that's important to you, then that's important. So therefore, it's important that as you're talking with your doctor, that you look for cues that he's going to be receptive to talking about such things. And that to realize that none of this, regardless of what your concerns are, none of this will be viewed as superficial. You're under a lot of stress, your doctor is appreciative of that, and he or she will, they're understanding. Don't worry at this point what he or she is going to think. And, in fact, keep reminding yourself that your questions, they're the same or similar to every other woman your doctor has seen, and that such questions, they're normal. They're normal responses to such a diagnosis. And then you're going to be able to relax more about it. And you'll be able to get down to talking honestly about the nitty-gritty aspects of living with breast cancer, so that you can find the path that best suits you. And that's what matters.